I lead the program of work that enables university researchers to use patient data from the Greater Manchester Care Record for COVID-19 related research. What's unique about the GM Care Record is that it's about all citizens from one locality. And that's not true for any of the other datasets that we have. So this enables us to do place-based research and place-based innovation and use the results from research directly to improve the health and health services in Greater Manchester. So what really excites me about the use of electronic health records for research is that we get really good insight in what's happening in the real world, in real-world clinical practice settings to real patients. And very often, which sounds paradoxical perhaps, but very often that is not true for health research. But it is true if you use electronic health records, and it is certainly true if you use the Greater Manchester Care Record, because every citizen in Greater Manchester is in the electronic health records. It's, in a way, a more democratic way of doing health research because we see and hear everyone, and it's more true to what's happening in the real world. It's really important that we make sure that we protect the privacy of the citizens that are described in the Greater Manchester Care Record. And this is obviously something that I care about myself as a citizen as well, because I know that my data are in there. So what we do is, before we as researchers see the data, anything that could possibly identify a person, a name, telephone number, NHS number, address, all of that is stripped out of the data before we see it. So that means that the data are reduced to a set of codes that is entirely anonymous. It's good enough to do the research, but it could never be traced back to an individual. We created a process for researchers where they can approach us with a proposal for a question that they feel is important to answer. And then we work with them to assess whether it's feasible actually to answer that question with the data that we have in the care record. If that is the case, the proposal is described in more depth, and that detailed proposal is then assessed by two governance groups. If they both agree, then the study goes ahead. So let me give you a couple of examples of studies that are currently in progress. So the first one is around the healthcare utilization, so the use of NHS services during the pandemic, so during the last 12 months. And that's a really important question because we know that utilization of healthcare services has dropped tremendously during the pandemic, but we don't know exactly which patients and patient groups were hit hardest by it. So that's what we're going to try to find out. The second study is around the risk of contracting COVID-19 in patients who are being treated for cancer, and also around the risks for them, if they get it, to be admitted to hospital or even die from COVID-19. And that's really important because we know that these patients are vulnerable, but we don't know really to what extent. And the third study is around the equitability of the UK vaccination strategy. And we look at the effects of the vaccination in different ethnic groups and different socioeconomic groups. So at the moment we're using the Greater Manchester Care Record only for COVID-19 related research, and it's been tremendously valuable to do that, to answer all those questions that we have around COVID-19. But I do hope in the future we can also use it for other questions, because we have so many more questions, especially in Greater Manchester where we have so many health inequalities. There's lots of things that we need to explore further, because all of that can then help us to create better health policies in the region, and with that, better health for the Greater Manchester population.